Dan Schmitz. What does it say on your business card?
It says Global Head of Product Development for Abbott Nutrition.
What would you like it to say?
So my title would be CCO, Chief Cheerleading Officer.
All right.
Of good ideas.
Let's use that alternative title. Thanks,
Okay,
Dan.
all right, thanks. Okay. So I hope everybody enjoyed lunch. One of the things that struck me at lunch is all the array of choices that we have, and we've fret over all those choices we have, and then as you go through and finally decide what you're going to get, we then really struggle on how much to take, and that's sort of kind of sums up our struggles around our meals, as opposed to the 800 million other of us who struggles about whether they will have any meal or not. So everyone in this room and everybody watching is well aware of the role of nutrition in optimizing health. One of the benefits of my 30 years in nutrition research and development is that I've actually got to see this in pretty dramatic fashion. So whether it's in a hospital NICU or whether it's in a clinic in Haiti where they're treating children with malnutrition, it's those kind of experiences that will make you very passionate about what you do. I'm going to be talking about a variety of partnerships, which I really truly believe is the way forward in making the kind of progress that we all yearn for. And I'm going to begin with an example of one of our partnerships.
In nutrition science, we answer lots of questions. Non-profit organization PATH came to us to improve their ultra rice. The questions were, can we make grains which looks and tastes like natural rice? Will the micronutrients be stable to storage, cooking, and be absorbable in the body? So when the team solved these questions rightly, we knew that done right, it can help millions throughout the world.
So this was our partnership with PATH, and I'm very proud of the work we did together. We truly advanced the field of rice fortification, and we can now take ordinary rice and, unbeknownst to your taste buds or your eyes, turn rice into a virtual superfood that has been decosted in a way that makes it commercially viable to put that fortification in, as well as bolstering the amount of bioavailable iron, which is absolutely critical in areas where anemia is prevalent. I'm also very proud with our Abbott's Foundation, the Abbott Fund, which invested $1.5 million with PATH to spearhead catalyzing the scale-up of this fortified rice in a very high-quality way. And in fact, just at the start of this year in the state of Karnataka, India, they launched the first of its kind in scale in India school lunch program incorporating fortified rice to 450,000 children per day. A great example of scale. So partnerships come in all shapes and sizes. And we've done partnerships with Partners in Health, building a factory in Haiti which produces a product to treat severe malnutrition. We've had great partnership with TechnoServe, for instance, we've had a variety of those working with improving the dairy supply chain in India. But we also have partnerships where it's about education. So in India, through our Abbott Nutrition Health Institute, we have focused on training healthcare practitioners in the NICU settings to improve these types of regrettable prematurity rates and the mortality and morbidity associated with prematurity. Also, through our Abbott Fund Institute of Nutrition Science, which was created about 10 years ago, operating in China and Vietnam, over those 10 years, we have trained 6,500 healthcare practitioners on clinical nutrition And one measure of the progress with that program is that in one of the largest children's hospitals in the world, in Shanghai, they have reduced by 83% the number of children that are being treated in the hospitals from malnutrition. So you think about reducing that level of malnutrition of patients in a hospital who obviously are being treated, and if you don't treat the malnutrition first, the effectiveness of the other treatments are going to be much less. There's no doubt that science, and I'm a little biased because I'm a scientist by training, but there's no doubt that science will play a big role in shaping and helping us achieve food security stability for 21st century. But even more important than the science is going to be the partnerships like these. The partnerships that can translate the science and scale the science to really have the type of impact that we're looking for. And I do know 800 million individuals today that are looking for us to be successful at doing that. Thank you.
Nutrition scientist for a Fortune 500 company. What difference are you making to the world?
So, in my 30-year career in nutrition research, I've had periods where I headed up food safety, and I now head up global product development. So in that capacity, there's obviously a lot of connections between the work that I do through Abbott with the types of things that we're interested in doing from a food security standpoint. So I work very closely with our Abbott Foundation and our Global Citizenship Group. And we try to find those partnership opportunities. So as we look at these, we go in and we try to find that kernel of what we do. You can never do everything yourself. Even a big company like ours, you need partners, and you need partners squared. So just as an example, one of the successful partnerships we had was Partners in Health and building a factory in Haiti. And one of the foundational parts of that effort was peanuts. We're not a peanut company. So there were so many aspects of this. So we had to engage the peanut industry to work with that. We had to work with TechnoServe because we had to grow more peanuts. So there was a whole host of things. But part of that was it was very much about malnutrition treatment and the clinical nutrition around that. So it fit that way. But we knew we had to then surround ourselves with a lot of other good partners.
I'm always wondering, how powerful can particularly today, I don't wonder this every day, how powerful can a nutrition team be in a company like Abbott? Like, what's your capital and sway that you can have?
Well, I think one of the things that we bring, one of the great things, and one of the things I really admire about the business we're in, is our ability to take really good ideas, very small ideas, right out of a lab, right out of an academic institution, be able to put the engineering horsepower behind that, put in the supply chain distribution, the marketing, whatever it takes to make it happen. We can take little ideas and we can grow them up fast.
Are you able to get out of the office and go and see them on the ground?
Oh, absolutely. That's how it gets done.
All right. Tell me one where you've seen it, you know it works, it's still working, it's sustainable.
So one of the great examples, and probably the one I'm most proud of, is the work we did in Haiti with building a malnutrition factory. So the great thing about that, and of course it was very much a boots on the ground. We literally had a patch in the central plateau of Haiti, virtually no roads, no utilities, no water. Starting from ground up, bringing in some of our engineering team and going in and building the roads, having some way to get to it, putting utilities in, clean water, building the factory, and then going out and putting together the whole operation, putting together a high quality system. Microbiology testing and nutrient testing and things, but done in a very practical way to make it work. So we had a revolving door between Columbus and Port-au-Prince to make that happen.
I'm thinking about innovation, particularly in your field. What are the innovations that are happening right now that you can tell us about?
So I think one of the things that most excites me right now about innovation, so there's lots of things going on with innovation in the way of really improving, health. There's a lot of very specific medical conditions and things where nutrition plays a key role. But the thing that's really, I think, exciting, and one of the opportunities we're looking for with, is taking the kind of innovation that we do, and being able to take an innovation to commercialize it in a shared value way to really address some unmet needs. And specifically, I'm thinking where you have protein and micronutrient deficiency needs, which is pretty prevalent in large areas. As we talked about this morning, I mean, there's just, unacceptable levels of stunting around the world. And so those are the types of things we would like to land upon the right innovation.
Who haven't you met today that you would like to have a conversation with?
About half the people in this room, to be quite honest. Everyone.
I'm asking, what's your agenda here?
Everyone has a story. My agenda here is to say, as you think about taking great ideas, bringing them to fruition, bringing them to scale, think about the nucleus of a partnership, but recognize, and I hope the thing that you realize out of that is that, if there is that kernel there, and for us it's around clinical nutrition, but all those other parts, don't worry about that. Don't be afraid to approach and see whether or not there's opportunities there, because again, great things happen when you partner.
All right, great things happen when you partner in life and in science. Yes. Thank you so much, Dan Schmitz.
My pleasure.
Appreciate
Thank
it.
You. All right.
Thank you.
Thanks, Femi.